Welcome back. We are starting a new series here on News Channel 3 Midday, talking with Santa Barbara County Public Health and other leaders around the county about this pandemic. So we want to get the very latest, and joining us here on Midday is the Director of Santa Barbara County Public Health, Do-Reynoso. Thanks for joining us.
I'm glad to be here.
All right, let's start with just where we stand right now. Obviously, the post-holiday stretch was terrible for everybody, especially here in the state of California and then locally. Where are we now? Is there an improvement? And how do you see things playing out over the next weeks and months?
I'm super excited that we are seeing a downward trend in our cases and our testing positivity. So I'm thrilled that our hard work, the adherence by our community members is coming to fruition. Our case rates are going down, as well as our testing positivity going down.
That's good news. And then the red tier is around the corner, I'm guessing. That'll be up to the state.
I hope so.
But what are the metrics, again, for people that maybe aren't following it day to day, that we need to get to be able to open more things up and get into that red colored tier?
So we are in the purple tier right now, and we hope that we will get to the red tier next, and that means a case rate of below 7 new cases per day. So we hope to get there. The latest numbers show us at somewhere between 18 and 19, and so we have a little bit more work to do.
Vaccines will certainly help in that, and I know that is going to be the big push coming from public health over the next weeks, months, and, really until this thing is stamped out for good. When it comes to vaccines, where are we right now, and who's going to be up next? A lot of people still waiting.
Right. So I am somewhat encouraged by the number of vaccines coming into our county. Just this week, we are getting another increase, and so that's really good news for our county residents. What's up next is that 70% of our allocation will go to the 65 plus, and the other 30% will go to 3 sectors: the food and agricultural sector, the child care and education sector, and lastly, the emergency services sector. So that's what we can anticipate coming up.
Is the county ready to, you mentioned you're getting more vaccine. Are you going to be able to ramp this up immediately and get shots in arms, or do you still need people to, I don't know how, right now you have to make an appointment. Is this going to change to where you can get it somewhere else more easily?
We are absolutely ready. So we have a network of vaccine providers assisting us. In addition to that, public health has our community vaccination clinics. And just like, for example, last week you heard that we had to cancel some vaccine clinics due to the winter storm. This week we were able to serve 15 to 1,600 community members at each of our clinics. So we have 3 clinics a week, and we're able to ramp up. In addition to that, our providers have been ready. We have been ready. So it really is, we're ready for this moment in getting the increase in vaccines. Community members will still need to register for their appointments, and I anticipate the number of appointments increasing on a weekly basis as our vaccine allocation increases.
On a weekly basis right now, what are we doing vaccine-wise?
So just 2 weeks ago, we were getting right under 6,000. Last week, we received a little bit above 8,000. And this week, happy to say that we're looking at 14,000.
So that's a
roughly.
huge increase.
So, definitely. So that's why we're excited for this moment. It's a moment that we've been waiting for, because we've built the infrastructure. We have just been hampered by the lack of vaccines. So we're ready.
Wow, from 6,000 to 14,000, that's huge news. When it comes to senior living centers, we're kind of still amazed as we watch it and we go report on stories that there are some that haven't received the vaccine yet or are still waiting for their first dose. How's that possible?
And that troubles me too. Absolutely, because we're talking about a very fragile community, a group of community members. So the skilled nursing facilities and long-term care facilities are being vaccinated under a federal partnership between them and CVS and Walgreens. And so unfortunately, we have been not part of that
Hmm.
conversation. However, because they are our community members, we have been actively working with these facilities, advocating for them to get the vaccines as soon as they can. And in some cases, we have gone in and supported that facility with our own vaccines as well.
Got it. And then finally here, schools are going to be opening in Santa Barbara Unified next week. We're seeing more and more of this ramping up along the Central Coast. There is still concern, though, teachers to get vaccinated. What is your message to them? Are schools going to be safe to reopen? The science community, CDC, says yes. What does public health say here locally?
We agree with what CDC says. We support that guidance that you can reopen schools safely with personal protection, with everyone masking, social distancing, sanitation. And I think that part of that also is testing. And another strategy, the ultimate end strategy, is making sure that when the vaccine is available, that everyone who has the opportunity receives the vaccine. So we have been in planning with our school superintendents and our vaccine providers. As a matter of fact, we have a meeting later on today to work through the operations, work through the logistics, so that next week we anticipate being able to offer appointments countywide with regards to supporting teachers.
If they want a vaccine, can a teacher easily get an appointment, or do they have to kind of go through the same things that everybody else is doing?
I think that unfortunately, because we have vaccine limitations, that teachers will also need to schedule their appointment. And with limited availability, some may get an appointment sooner than later. But again, we are working through a very intentional and thoughtful way with our superintendents on how we can best support childcare and education.
Do-Reynoso, the director of Santa Barbara County Public Health, thank you for joining us and giving us an update on what's happening here locally with the pandemic. We appreciate it.
Great. Thank you for having me.